Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Clinical aspects of dyspnea. So, what is the classification of dyspnea? Dyspnea can be classified based on the time of occurrence of dyspnea. If the dyspnea occurs in minutes, suddenly, if the dyspnea occurs in minutes, it can be due to pneumothorax, pulmonary edema due to cardiac arrhythmias, major pulmonary embolism, inhalation of the foreign body, laryngeal edema. If the same dyspnea occurs in hours, then it can be due to asthma or left heart failure or pneumonia. If the same dyspnea occurs in days, then it can be due to pneumonia, acute respiratory distress syndrome, and left heart failure. We see that the dyspnea occurs in days. Even in repeated pulmonary embolism also, dyspnea occurs in days. Dyspnea can take weeks to occur. Like in chronic diseases, it might take weeks to occur. If it takes weeks to appear, then it is seen in pleural effusion, anemias, muscle weakness, or in tumors. Sometimes the dyspnea may take months to appear. So in that is slowly the dyspnea starts to appear and it will worsen. So this is seen in pulmonary fibrosis, especially due to restrictive lung diseases, thyrotoxicosis, and muscle weakness. Sometimes dyspnea may take years to appear. So, years to appear, the dyspnea can be due to muscle weakness or chronic obstructive pulmonary disease, or in chest wall disorders, the dyspnea may take years to develop and to become severe.
thank you and thank you for watching.